Welcome. My name is Brent Murphy. I'm the founder and president of RTU. RTU is going to have a medical physics residency program. It's going to kick off in the summer of 2011. We're pretty excited about this. What makes it different? Right? Several things make it different than other residency programs. It's curriculum. We follow the recommendations of Task Group 90 and the recommendations of CAMPEP. Okay? This field of medical physics is changing and the standards are changing. We want to promote this profession and make it better. And one way to do that is to have a very strong residency program, right, that can be delivered in a very unique way. Right? We can separate out this residency program into maybe 3 8-month stages or possibly 4 6-month stages. Whichever works best is what we will follow. It will have didactic boot camps, if you will, to reinforce the education from graduate school and fill any voids that were not filled. It will include medical physicists going through the dosimetry school and learning how to treatment plan and how to evaluate a plan, how to evaluate contour sense. It's going to be very clinically oriented. It's going to be very safety oriented, right? And it's going to be very, very intense as far as the specialties. Now, how can we do that? We've got to have faculty that are what? Clinical senior medical physicists that are passionate about teaching. We've got to have a senior residency director that can keep track of everybody, that can mentor people through, and then we'll have multiple discipline instructors such that you're learning a specialty from somebody that's an expert in the field on that specialty, right? So you're going to learn, you're going to be tested, you have to demonstrate competencies. It's not going to be a walk in the park. It's going to be very dynamic and very intense. So how can we deliver that? How can we optimize that so that physicist, right, learns the most over this 2-year period? Well, not only do you have residency hands-on in the clinic, right, this is going to be augmented. It's going to be augmented in your competency areas by a virtual training platform, right? So you may see something twice, but you could go watch it virtually 100 times to review it before you test out on competencies. We're going to utilize boot camps so that we can break down and find the weaknesses, if you will, within each medical physics residency student, right, or resident, right, and we're going to build on that so that we can meet all the standards. It's very exciting. So, what is the entry process? There's an application to fill out. There's going to be evaluations coming from your, graduate school professors, right? But what we're excited about is that we're going to take that blended approach, right, and just make very well-rounded medical physicists coming out of this residency program. RTU has a lot of relationships through the past 10 years through its relationship with Advanced Radiotherapy Consulting, the education and training branch there. In the past decade, ARC has trained over 2,000 professionals. That includes radiation oncologist, radiologist, medical physicist, medical dosimetrist, therapist, technicians, x-ray techs, nuke med techs, right? Radiation oncology nursing, and administrators, right? Having these positive relationships creates opportunities for growth and possible employment. So in closing, if you're passionate about this field, you want to make a long-term difference, right? The difference is building your foundation now in your career. If you're willing to accept that challenge with the RTU Medical Physics Residency Program, we're willing to accept that challenge, right, and give you the deliverables, the tools, the training and education, right, in that clinical training environment augmented by the virtual training environment to get you to that point. To learn more, visit the website or give us a phone call. Thank you.